talk about professionalism a little bit today. And one of the things you need to know is when I took over the program 4 years ago, it was a wonderful pre-med program or pre-health program. We tend to overemphasize medicine. But as I took seriously the title of the program, the Pre-Professional Health Sciences Program, I was attuned to, or the thing that stood out to me was the idea that it was a pre-professional program. And I guess that's important is because in the process of thinking about the program and thinking about our students, I thought about how difficult it is or how unfair the expectation is that we would have these 17, 18, 19-year-olds up to 21 and maybe a little bit older who we were requiring to act in a very unnatural way. That is, we were expecting them to be very focused in their studies, schedule all their time, and conduct themselves as professionals both in the classroom but also in their volunteer experiences and shadowing experiences. And most of their colleagues are off eating ice cream, playing basketball, doing all kinds of things. And here they are expected to be little 30-year-olds. Because in some ways, I think it's reasonable to expect a 30-year-old to be professional or mature adult, which is an aspect of professionalism. So the term professionalism or professional first emerged, I think, in the English lexicon in the mid 19th century, 1859 or something like that. And but still, it's difficult to nail down what exactly it is. One can imagine a doctor that's professional, unprofessional, a principal that's professional, unprofessional, even a kindergarten teacher that's professional, unprofessional, or a professional pizza maker, or soccer coach, or soccer team. It's a very elastic term, and I think part of what professionalism captures is someone who's an expert, who has a mastery of a certain body of knowledge or certain art form or certain skill set. But there's also the possibility of thinking about it in terms of accountability, altruism, entering a social contract with society, caring for others. Um, and there's a number of other things one can consider when one invokes the term or evokes the term professional. You meet people, and if they're professional, you know it, and they may be very casual. They may not be in a suit. Someone else may be suited and booted, as we say in my community. And yet, the effect of their engagement or their service is not yet, not quite professional. So today, I'll be interested in seeing how our students are thinking about their um, their definition of professional based on reading by David Tipton. We were blessed to find, or I was blessed to find this book by David Tipton, Personal and Professional Growth for Healthcare Professions, um, around the time I began thinking about this idea. So this is our Bible for the program, or one of the most important books that our students should own or have to purchase and read. And so today, I look forward to hearing what our students hearing and seeing what they prepare, but also having conversations with our students around professionalism. We definitely want to move away from a very superficial and corny and robotic notion of professionalism to something that's richer, more natural, more spontaneous, and and it's something that our students feel comfortable with because they are figuring out what are age appropriate and activity appropriate ways of being professional as undergraduate students.
As Dr. Hunter states, David Tipton's book on personal and professional growth is a wonderful resource that is able to tackle the wide domain of professionalism. Firstly, a profession, according to Cruz et al., includes mastery of a body of knowledge. When we think about a professional chef, accountant, teacher, or something of the like, we think of a certain level of skill and associated autonomy. Furthermore, Cruz et al. States that there is a specific code of behavior as well as a social contract to do good for the individual and society. Tipton reports that those who adhere to the standards of professionalism and practices within that profession is a professional. Tipton applies this to medicine. First, he points to accountability. Accountability to individual patients in fulfilling covenants of patient-provider relationship, to society's health needs, and to the profession for honoring their codes of conduct. To be a healthcare provider is to be accountable for reliable delivery of care, confidentiality, equity, cultural representation, and more. Also, it means you have to own up to your own successes and mistakes, which can be difficult. Secondly, altruism is the willingness to serve the best interest of the patient rather than your own. Two mechanisms of altruism are mentioned. One is self-serving with the focus on self-satisfaction and creating a good reputation. The second is purely for the other. According to Wang et al., true altruism can be learned. A study shows that training in compassion has been shown to increase altruistic behaviors. Thirdly, excellence, which is conscientious commitment to improvement. According to Tipton, he states that deliberate practice is the most important. There must be self-reflection combined with repetition and focus. As being a healthcare provider is a pursuit of lifelong learning, the journey is one that requires willpower. Fourthly, duty, a commitment to serve the patient even when it is inconvenient. Obligations to certain codes of conduct are necessary. Tipton expands on duty to state that healthcare professionals are to have obligations as their character interacts with all contexts, whether it be with dealing with patients or with insurance companies. Fifth, honor and integrity, a commitment to the highest standards of behavior. Like duty, there's a code. Tipton states that there's morality that is a set of rules or doctrines that delineates right and wrong behavior. Virtue involves conforming to these standards to the everyday problems in life. To adhere to a code of honor and integrity, Tipton argues for the conscientious professional. He or she is reliable, punctual, diligent, persistent, self-regulating, achievement-oriented, methodical, trustworthy, and more. Sixth and lastly, having a respect for others. A belief in the value of all human beings, including patients, families, and other healthcare providers. This means to afford every person respect, no matter what that person's socioeconomic status is, what conditions they're in, what accomplishments, positions, language, and whatever else that they may have. This respect, however, is dynamic. It changes given the context. For example, the practitioner has a unique obligation of professionalism to provide the best care, whereas your respect to your colleagues is different. It is to be civil and able to cooperate to complete tasks.
Tipton writes in his book Personal and Professional Growth, however, whether students realize it or not, their voluntary matriculation into a program obligates them to the same professional standards as graduate licensed practitioners. This is not a matter of choice. Although students may be initiates and novices, they are professionals nevertheless and have professional obligations and standards that extend to the classroom, the laboratory, the experimental site, relationships with faculty, staff, and administrators, and any other academic pursuits. Essentially, what Tipton is saying is that we as students are still expected to be professionals in whatever setting we are in. Although we might not be in a traditional workplace setting, professionalism still matters. Tipton also writes, the student is obliged to apply the same standards for professionalism to the academic context as they would to the work context. Tipton is saying that we need to have a high standard of professionalism. While it's okay if we mess up, this is our time to make mistakes. As Tipton writes, school is the professional practice site. However, we must still be striving for the highest level of professionalism.
One of Tipton's focus points in his book is on the culture and atmosphere of the workplace. He discusses the many relationships of the workplace and how to manage them. These relationships include those with bosses, supervisors, and coworkers, as well as the culture and politics of the workplace as a whole. It is very important to be emotionally attuned as a professional. In his book, Personal and Professional Growth for Healthcare Professionals, Tipton says that something is always going on that may affect individual and group dynamics in the workplace. Shifting power, influence, and interpersonal relationships are a few of the many potential dynamics which could change the atmosphere and functioning of any workplace. Tipton aptly asserts that culture is the way to get things done at work. Especially when one is first learning how to act and interact in a new job, office or job position, They must recognize that there is much to be learned by reading between the lines of the pre-existing dynamics. What is this organization about? The deepest level is where the unspoken and tacit assumptions reside. They are not seen or discussed in everyday interactions. These are the unspoken rules of the workplace. These unwritten rules will almost undoubtedly be learned eventually, but in order to build a positive reputation and earn respect from others in the workplace, one must be humbly sensitive to the fact that he or she is new to the environment and is uninformed about some of the many important details of how the office functions. As students learning the written and unwritten rules of professionalism throughout our undergraduate years, Tipton discusses how we can focus on cultivating a few specific types of relationships right now that are all based on trust, respect, teamwork, and open communication. First, collegial relationships are those in which people trust and respect each other and hold equal responsibility. Second, collaborative relationships require that people trust and respect each other in order to work towards a common goal. Third, student-teacher relationships involve open communication and receptiveness to shared wisdom. And lastly, friendly stranger relationships are those in which there is no established trust or acknowledgement, but courteous formality leaves the possibility for a future relationship open.